Our topic was healthcare for transgender people, and it was done by Nicole Rita, Jill Schweizer, and Dana Banderick. It is illegal for insurance companies, health providers, and other health programs to discriminate against transgender people. Many transgender people still face discrimination with healthcare, but there are laws that can help them avoid discrimination or resolve their issues with it. An example of an important law that helps them resolve these issues is the Affordable Care Act, which prohibits sex discrimination, including anti-transgender discrimination, by the vast majority of insurance companies and healthcare providers. Insurance companies also cannot have automatic or categorical exclusions of transition-related care. For example, an insurance company that says that all care related to gender transition is excluded violates the Affordable Care Act. An insurance company also can't place limits on coverage for transition-related care if those limits are discriminatory. Another example of this is that an insurance company can't automatically exclude a specific type of procedure if it covers that procedure for non-transgender people. That means that an insurance company may be breaking the law if it covers breast reconstruction for cancer treatment, hormones to treat postmenopause symptoms, or genital surgery after accidents, but won't cover those treatments to treat gender dysphoria. Under the Affordable Care Act, it is illegal for the following to discriminate against you: physicians' offices, hospitals, community health clinics, drug rehabilitation programs, rape crisis centers, nursing home and assisted living facilities, health clinics in schools and universities, medical residency programs, home health providers, and veterans' health centers.
The federal judge's decision to issue an injunction blocking enforcement of federal protections set to ban discrimination in healthcare services based on an individual's gender identity, as well as reproductive health services, is currently in progress. However, many people are still extremely resistant to not interfering with transgender people's basic rights. U.S. District Judge Reed O'Connor's decision came in response to a lawsuit filed by Texas and several other states, as well as religiously affiliated medical groups, seeking to overturn a U.S. Department of Health and Human Services regulation implementing Section 1557 of the Affordable Care Act, which forbids discrimination in health insurance and by health providers accepting federal funds. O'Connor is the same judge who in August issued an injunction blocking the U.S. Department of Justice from enforcing school districts by the U.S. Departments of Education and Justice that transgender students have a right to be treated free from discrimination in schools, specifically based off their gender identities. Currently, the U.S. Department of Veteran Affairs is currently in a decision to withdraw a proposed rule change that would have allowed veterans access to gender-affirming surgery. A federal judge in California has ordered the state to provide an inmate with gender treatment for her gender dysphoria. Michelle Lale Norsworthy, who is in a California state prison, sued the state after being denied access to gender-affirming surgery. According to the district court's opinion, Norsworthy began identifying as a woman in the mid-1990s and was diagnosed with gender dysphoria in 2000. The majority of mental health professionals who have worked with Norsworthy agree that she should be able to receive surgical treatment. Transgender individuals have a high prevalence of HIV/STDs, victimization, mental health issues, and higher suicide rates. They are also less likely to have health insurance than heterosexual or LGBT individuals. Unfortunately for transgender individuals, employers can now claim so-called religious exemptions as an excuse to deny healthcare to approximately 55 million women and an untold number of transgender and non-conforming people who rely on no copay contraception benefit provided by the ACA. After last month's failure, the Trump administration is once again lobbying House Republicans to repeal the Affordable Care Act. The emerging reworked repeal contains language to defund Planned Parenthood, which is one of the largest providers of transgender health care in the United States. On top of providing LGBTQ-inclusive sexual and reproductive health services, STD testing, birth control, and physical exams, a growing number of PPFA centers provide hormone replacement therapy for people who are transgender. New York Governor Andrew Cuomo and New York State Health Commissioner Nirav Shah are being called upon to overturn New York State's Medicaid's regulation excluding transgender people from accessing care.
graph displays how transgender people are treated poorly in the healthcare industry, even in comparison to the rest of the LGBTQ community. A whopping 52% of those surveyed were refused service due to their trans identity, while only 9% of LGBT people were. 73% were treated differently, 89.4% received care from inadequately trained professionals, 50.5% were not given good support group options, 58.8% were not able to be treated for substance abuse, which is especially concerning, considering that this is a serious issue that should be treated the same way, regardless of orientation. The next chart shows the extent to which people are transphobic. 15.4%, approximately 3 out of every 20 trans people seeking care were considered untouchable or dirty. Another 20.9%, essentially 1 out of every 5 trans people, were verbally harassed by healthcare professionals, displaying the insensitivity and degradation of trans people even when they are supposed to be made comfortable, especially in the area of their own personal health. The next table displays that 20.3%, or 1/5 of trans individuals, were blamed for their current health situation, when the entire point of seeking medical attention is so that they can help fix whatever problems or dissatisfactions are occurring. In addition to this, 7.8% of trans people were physically harassed. While that number is not as large as the others, it is still significant in that no one should be treated in a physically harsh manner, but the fact that close to 10% of a singled out minority of people is atrocious and disgusting. The last table is just a review of all the statistics shown that in a world where the LGBT community is already discriminated against, there is still an astronomical difference in the way transgender people are treated as opposed to the LGBT sect of the group.